All right, good evening, everyone. My name is Ryan Stahl, and today I would like to talk to you about physical therapy worldwide and how it is a global issue to access it. First, I want to talk about five different limitations to physical therapy worldwide. The first one would be global access, then the education and training required for physical therapy, the regulation on physical therapy, and the technology advancements towards physical therapy and the health system's policy of physical therapy. First topic I want to talk about is the global access to physical therapy. We have three areas that can't really get physical therapy, such as rural areas, such as the country, just due to the inability to have buildings for it and how long it takes to get to these certain areas. We have low income areas, as they're not able to afford to put a physical therapy clinic in or a hospital. And we have third world countries, which, as the picture shows online, they would really struggle to get physical therapy there, as they do not have much to begin with. The next topic I want to talk about is the lack of physical therapy from the educational needs. Three main reasons that makes it hard to become a physical therapist is the cost of education, which is roughly 175,000 to 350,000, which I found that undergrad degrees on average cost 100,000, right around 100,000 for most colleges, and the doctorate degree obviously costs more as graduate degrees cost more. And the time to become a doctorate of physical therapy is 7 total years. Now, sometimes you might have the opportunity to get 6 years in a 4+2 program, but almost every program is 7 years long, which is very time consuming. It's a good part of your life. The course load is also another problem with certain courses being harder to weed out the amount of courses, the amount of work, and balancing your clinicals is very difficult, causing there to be less PTs, less people signing up for physical therapy degrees, which would then allow less physical therapists to be out there in the world to give access to everyone. Another problem with physical therapy is therapy regulations, which I know stateside here, we in certain medical fields only have licensure to certain states unless you go through extra training for it. But I know from one country to another, we're not going to be able to just transfer our license like that. You're going to have to retake the exam to get certified, your board exam, or you're going to have to, excuse me, or you're going to have to, oop, sorry, or you're going to have to retake your exam altogether and your whole course schedule again with extra classes. Another thing would be the inability to perform certain tasks without extra education, such as certain things in the field, maybe new requirements causing you to have to take even more schooling on top of what you do on a normal day's work. Another disadvantage to physical therapy, which causes problems to get everyone access, is the technology disadvantage. Now, not every country has advanced technology like we do here. Some people struggle to get running water and a place to live. I know that. But if we were able to get the technology, say even a simple computer or smartphone to everyone, we could use telerehab to actually expand physical therapy. Now, telerehab is a remote screening and video calls to speed up the process of seeing a doctor of physical therapy. We could use this to maybe not the actual first assessment, but assessments afterwards, progress wise, or the certain exams you have to take beforehand, going through your symptoms and your problems before you can even get referred to a physical therapist. Because I went to a physical therapist once and it took, I think, a couple months to even get referred to the physical therapist for my back pain. Another thing with technology that could be helpful and I feel like isn't getting used enough in physical therapy to expand it is the wearable tech. Things such as Apple Watches and Garmin's, the fitness trackers, they could be used to actually monitor patients' workouts and their breathing rate, their sleep, things like that to help the patients heal and make sure these tasks are actually getting done. And if we could monitor them, that would be very beneficial to expanding this. One of the main things I think with physical therapy that would cause a problem is the healthcare policy. The insurance costs are skyrocketing everywhere, and the approval of physical therapy from your insurance is hard to get and covering costs based on what your insurance wants to cover. I know personally when I went with my Geisinger insurance, it was $20 for maybe 10 visits. But when my boss went to go, his first appointment was $200. My boss that I had over winter break when he went to go, his appointment was like $200. And the policy differs between different physical therapy organizations, causing it to be even harder or easier to get into certain ones. I think this is really important to expand physical therapy to everyone, as it can be a great thing to help people grow and become stronger and more adept to do things. A little background that I want to give you on why I was interested in this topic. I am going to Lock Haven in the 3+3 MSAT program, which is the Masters of Science Athletic Training Program, and it's accelerated. I personally love the rehabilitation part of physical therapy, but I also love the emergency care part of physical therapy. So that's why I'm doing both. That's why I'm doing athletic training as it combines the two. My personal experience with physical therapy, I used physical therapy for a couple months for lower back pain, and it really did help. And it was nice to have someone to talk to about my pain and just about my day when I saw a physical therapist. And I believe, just a personal belief, that we need to help everyone that we can. I believe getting physical therapy out there to the whole world would be a great way to help people become stronger, feel better, more confident, happier. And I personally love watching someone progress and become healthy as they go back to their sport, their job, their life playing with their grandkids. Simple things that we take for granted sometimes. Thank you for your time, and I hope you have a great day.